Thank you for coming, and please stay till the end. We'll be sharing some gems. So today is the 7-day health dental health challenge. Are you ready? I am ready. So as a disclaimer, this information on this channel is for general informational purposes only. We emphasize that dental prevention is better than cure, but it's also important to realize that this is virtual and you need a face-to-face consultation. So, what are we going to learn? Today, we're going to learn about what to do every day for the next 7 days and why it is important to know about dental prevention is better than cure. I'm sure you are all aware that most people wait until tooth hurts before taking action. Today, I'm going to challenge you on this 7 day to be able to be responsible for your own teeth and also to practice dental prevention is better than cure. So, this is a series of challenges every day that you're supposed to do. Are you ready? I am ready. So, before we start, I would like you to brush your teeth, use a gauze to wipe your teeth or tissue, and use your own mobile phone to take a selfie of your teeth, of your natural teeth. What do you see? In this, I can see teeth, and the shiny part is the enamel, one of the strongest material in the body. I can see the gum, which is pink. In some people, it's darker, and because of more melanin, so it may be pigment or pigmentation. I can see the upper central incisors and the lower central incisors. The gums look healthy. It's not bleeding. So these are things you can see for yourself by taking a picture of your teeth and then analyzing it and asking yourself, what do I see? Using your own mobile phone. And then the second day, which is day 2, is sugar audit. I want you to take a sheet of paper and write all the sugar that you are having during the day. How many times you are having drink or how many times you have sweets. The best time to eat sweet is after meals, not in between meals. You can have sweets, but it should be in one go. And also, if you are in the UK, you can download the food scanner app in App Store or Play Store, and it tells you how much sugar in the food. So the best time to eat sweet is after meals and use a straw. Do you know that when the bacteria in your mouth feeds on the sugar in the food, it produces acid, and that's the acid that attacks the teeth and leads to tooth decay. 2 minute brushing. You need to brush 2 minutes. I prefer manual. I've got my manual toothbrush here. So you hold the toothbrush at an angle of 45 degrees like this. Do the roll technique, applicator, applicator, applicator. For the roll technique, and then brush all the surfaces and brush your tongue for 2 minutes. And now check for ricks. So when you open your mouth, you can see fishes in your mouth. That's those marks on your teeth. So at times it's stained and at times it could be decay, it could be brown or black. At times, if it is black, it means there was a time you used to eat a lot of sweets and now you stop. So the tooth has repaired itself. So it's very important to look out for those stains and teeth just by looking in a mirror. The importance of saliva. Day 5, we're talking about saliva. Saliva is very important. It helps you to speak. It helps you to swallow. It also starts out on food to produce acid. So it's very important. That is why it is important to have sweets after meals, because when you eat sweets after meals, you salivate a lot and it washes away the acid. So saliva is very important. And I've already done a video on importance of saliva. I'll put the link in the description, or you can check my other videos to see more for more information. Day 6, we flossing our teeth. The lady in the picture is holding a floss stick. For those of you who have difficulties using a proper floss, you can buy a floss stick. This is how to floss. You take a piece of floss, middle finger, roll it round, and you're left with just your thumb and index, and then you come like this, wrap it around the tooth like a C, and then move it up. Don't go like that. So you go like that, wrap the tooth like a C and then round. For the back, it's difficult to use both your thumb and middle finger. It's very difficult to use both your thumb and middle finger. So you need to go like this, just using your index finger. Wrap around and clean. So that is how to floss. If you have difficulties, then use the floss stick. The 7, scan the QR code, which I'm going to do now. So I'm going to scan the QR code. So when you scan the QR code, you use your phone, your mobile phone to scan the QR code. That's what I'm doing now. And then you see the bit.ly and it says I accept. And then you see dentist AI, US West run up and then continue to destination. Yeah. And then when you continue to the destination, you come up with this. Yeah. You come up with this. It says take a picture of your upper teeth. So you take a photo of your upper teeth, allow, and then you go like that. So I've taken a picture of my upper teeth, and then it says take a picture of your lower teeth. You do this, and then you click. So I've done that, and then it says analyze teeth. So I just click analyze, which is what I'm doing, and it's going to give me a personal report. So you can also do the same thing. So this is my analysis. So that's the report is given. So it's saying it doesn't show any signs of decay, no significant staining or wear. And lower teeth generally appear healthy with some minor staining on the occlusal of the posterior molars. No overt signs of decay. And it also has given me general at-home care suggestions, like I should brush my teeth, floss, limit sugar, use mouthwash, consider drinking fluoridated water, maintain a balanced diet. And then there's a medical disclaimer. This is a screening tool. This is not a diagnostic tool. This is a disclaimer. So you still need to see your dentist for a checkup. This is a screening tool. This is just to help you detect risks of tooth decay in your mouth. So you still need to see your dentist. This is just to help you to monitor your teeth level. So at the end of the scan, you can see the hygienist for hygiene to clean your teeth, and you can see your own dentist for a checkup. If you're in London and you want to come and see me for hygiene and consultation, I'll be happy to see you. I'll be putting the email for you to contact me in my description. So just in case you want hygiene and consultation and a checkup, I'll be happy to see you. Thank you for staying till, and please subscribe for many updates. Thank you.